Hi everyone, welcome back to Allied Health 102 lecture. And as we discussed in lab, everyone should be finishing up today, um, Thursday, September the 17th at midnight tonight. Lecture test number 1 for chapters 1, 6, and 7 will close. And you took in, whether you were in the Tuesday class or the Thursday class of this week, you took your profiles and panels quiz, and you took your lab test number 1 on chapters 1 and 2. So now we've learned that, we've tested on that, and we're moving on, right? So this is the lecture PowerPoints, but because everybody's in lab and lecture, their labs may be split up, but let's go over in lab. Okay, so in lab, we utilize our white lab binder, right? And at the front of the white lab binder is our chapters. So we just took our first lab test on chapters 1 and 2, right? So, and we turned our packets in for labs on chapters 1 and 2. And now we move on to our next chapters, right? In our new lab packet. So now we're going to be, you guys should be reading chapters 3 and 4 at the front of your white lab binder and filling out the review guides in the back. And we will start working on, or we talked today about our venipuncture skills test that we will all be taking next week. And we're working on labs 5 through 8. Okay, so again, like I said, tonight, September the 17th at midnight, our lecture, first lab test and lecture on chapters 1, 6, and 7 will close. So then you guys immediately need to jump into this, and this is our next chapter, chapter 4. And so what you'll do is the same as you did before here in lecture. You will watch the PowerPoint presentations associated with chapter 4. You will fill out the review guides in your black lab binder, your black lecture binder, and you will read chapter 4 in your phlebotomy handbook. And then you will study those review guides for this chapter 4, and then we'll put up the other remaining chapters for the test. And then in lab, you will study, of course, you will read chapters 3 and 4 in your white lab binders and fill out the review guides at the end of each chapter. But you will excuse me guys, I can't talk today. You will also study the Appendix A. But guys, remember, at the top of chapters 1 and 2, you had some abbreviations. Make sure that you're learning those abbreviations. They're at the top of those review guides, okay? Because you will see those abbreviations on your test, okay? So let's move on from here. We're starting on chapter 4, which is infection control. And as I always say, here are our learning objectives, right? They're also listed in chapter 4 in your textbook. And these are the objectives that we hope to meet when we finish studying chapter 4. So these are the things, and I'm not going to read them off to you one by one because I know you guys can read, but you want to look at these because these are the things at the end of your studying you should know, okay? Okay, so we're going to start talking about pathogens and infections, right? So OSHA, okay? OSHA is the Occupational Safety and Health Administration. So you guys need to understand OSHA is just abbreviation, right, for Occupational Safety and Health Administration. This is an agency that is within the U.S. Department of Labor, okay? So you think labor, workers, right? And this requires employers to provide certain measures that will protect those workers on the job. Now, the ones we're going to concern ourselves with is workers, because this is who we are, right? Healthcare workers that are exposed to biological hazards like blood and body fluids. Now, there's lots of things that OSHA requires of employers other than protecting workers exposed to biological hazards. They do things like, I'm sure you've heard of OSHA before at a job you worked at, like you can't leave boxes stacked up in the hallway. The Department of Labor, and specifically OSHA, that agency that's within the Department of Labor, is about safety, right? The safety and health of all workers. But when it pertains to phlebotomists, lab workers, and a lot of healthcare workers, one of our main concerns is biological hazards, right? Needle sticks, being exposed to infections and pathogens. So that's OSHA's job, is to make sure that if you work at Minden Medical, that Minden Medical is following all the rules and guidelines set forth by OSHA to keep you safe, okay? Now, we understand that an infection, right, that's when some kind of virus or bacteria or parasite gets into our body and causes an infection, right? Okay, so the term blood-borne pathogen is used to describe any type of infectious microorganism present in blood and body fluids and can cause infectious diseases like hepatitis, HIV, syphilis, right? The most important source of both HBV, hepatitis B, and HIV is through the blood, okay? So here's some of our critical thinking slides, right? This is the way we learn. So guys, really use these as a tool to study for your test. So I'm going to go through these critical thinking slides as we go through, and each time I do, you take the time to pause these and see if you're starting to learn this stuff. And make sure you have your black binder out right now and you're turned to the review guides for chapter 4 and you're filling those in. And you should also read chapter 4 in your textbook, the Phlebotomy Handbook. Okay, now, nosocomial infections. Okay, these are the infections that are acquired in a healthcare facility. So if you go in the hospital because you broke your leg or broke your hip, and you're in the hospital for a few days, and then you get pneumonia, or you acquire some other infection that you didn't have when you came in, that is a nosocomial infection. Okay. So 5 to 8% of patients admitted to the hospital are likely to develop nosocomial infections. That number is high, guys. Think about it. If you're talking about every hospital in every state in the nation, that's a lot of people, 5 to 8%. That's a lot of people getting nosocomial infections while they're in the hospital. So antibiotics can, if you take antibiotics, okay, you got to remember that we have bacteria inside our body that's what we refer to as good bacteria, right? There's bacteria in our gut, in our intestines, our stomach, that is good for us, right? It helps us break down our food, okay? But we want that bacteria that's in our intestines that does its job to break down the bacteria. It needs to stay in the intestines. It's okay if it's in there because that's where it's supposed to be. It's got a specific job in a specific area. But when that particular bacteria gets to another area of our body, like our bladder, okay, it can cause us problems. And then we can acquire an infection and get sick, right? The two most common nosocomial infections are urinary, which make up about 40%, and wound, which makes up about 25%. Because the majority of patients in healthcare facilities have a catheter, urinary, and a lot have surgery wounds. So you think a lot of people come into the hospital and a big portion of them have catheters because something's going on and they don't want them to get up, walk into the bathroom out of fear they may fall or whatever. And a lot of people go to the hospital to have surgery, right? So the Centers for Disease Control and Prevention is the organization that oversees the investigation and control of various diseases, especially those that are communicable, okay? Because I know you may have heard stuff on the news during the COVID-19 that they were tracing patients, they were tracing them, right? Because we want to know when they got it, where they got it from. so that we can map this out and we can make sure that we stop that chain of infection and we get the person who's spreading it isolated, right? So Center for Disease Control and Prevention, they handle that. They investigate it. They find out who were you around, where did you go, who else did you come in contact with. They also oversee and investigate things like food poisoning. If you were to go to a restaurant and you and your whole family ate dinner and you got horribly sick and went to the hospital, the Center for Disease Control and Prevention may get involved, especially if there's 20 or 30 or 40 cases showing up in a short period of time of this same type of food poisoning. Then they may interview everybody that was sick, trying to pinpoint where they may have gotten the food poisoning. Did they all buy the same mayonnaise? Did they all eat at the same restaurant? If they did, what did they eat? So they can trace that back to what could have been the culprit for causing that particular outbreak. So they monitor patients and employees who are at high risk of infection or have acquired an infection. So the main role of an infection control department is to stop the spread of infection. So most hospitals are going to have an infection control department, and their job is to make sure that all hospital workers know the proper way to wash hands and they're doing it. They want to make sure that everybody has their TB skin test done, their flu shot done, that everybody's aware of changing their gloves. They are going to have all the policies and protocols in place to stop that infection. They're also going to be notified anytime an outbreak of staph happens so they can immediately investigate it, get on top of it, find out what's causing it so they can stop it, okay? So the cornerstone of infection protection is aseptic technique, right? That's what we've been talking about. Talking about washing your hands frequently, making sure you use the proper PPE, and making sure that you think before you toss and that you make sure that your trash goes in the right trash receptacle. Because if you throw a needle with blood or body fluids on it in the trash and someone sticks their hand in there, they could stick their needle in their hand and it could transmit an infection that one patient has into this environmental service worker, right? Or if you throw a bunch of stuff that's got blood or body fluid in the regular trash and they touch it, it could transmit that infection from one patient to the other. So we have to remember that the main thing we want to remember as healthcare workers is that we wash our hands frequently, we use our gloves and make sure we change our gloves, and that we make sure that we properly throw away our trash. Okay, guys, remember, UTI. Why? Because most people that are in the hospital, a big proportion of them have catheters. And those can having something inside your bladder is just think of it as a roadway right into the bladder. So bacteria that we talk about is outside everywhere on everything, right? Can travel up the catheter, get into the bladder, and cause a urinary tract infection. And remember, we want an infection control program in the department so they can work diligently to stop the spread of infection. So talking about personal safety from infection during specimen handling, okay? So all patient specimens should be handled with caution, right? To prevent the possibility of infection. This preventable approach is called universal precaution. It's like I tell you guys when we're in lab, respect the needle, okay? You have to always be very aware of where your needle is at all times, okay? The Needle Stick Safety and Prevention Act updated older OSHA standards to include requirements such as safer needle stick protection devices and placing fluorescent orange or orange-red warning labels on containers that contained blood. Okay, you know, you guys, when we're in lab and I show you pictures of some of the different tools we have, I show you some pictures of some old Vacutainer needles that at the time, and these are the Vacutaners I used back in the old days, didn't have the safety device on them. Those had not been invented yet. So literally those needles that I point out to you and I said, see these? They look just like the needles we use. They're Vacutainer needles, but you can see they don't have the safety device on them. That was prior to OSHA updating their standards and having the Needle Stick Safety and Prevention Act, because we were having too many healthcare workers being exposed to things like hepatitis and HIV due to needle sticks. And we needed to figure out a safer way to protect our healthcare workers. So exposure control, right? Exposures, you're being exposed to something, right? Whether it's a needle stick, whether it's an infection, whatever it may be. So any incident of exposure, whether you accidentally stick yourself with a needle or something splashes into your eyes, should be reported immediately to your supervisor. Now, once you immediately report this to your supervisor, you and your supervisor will fill out an incident report, okay? And it's going to include any safety device that you were using that didn't work, and details on the exposure itself. What happened? Exactly what happened. You always want to have the date and time and the location the event occurred. The reports must be maintained for legal documentations in case of a lawsuit. That's why I tell you guys over and over again, I want you to get used to using your black ballpoint pen. Okay, remember, the only reason we use permanent markers is for labeling specimens. They should not be used to fill out your lab report. Pencils should not be used for this. Black ballpoint pens should be used, okay? And we never scratch anything out or use whiteout. We put one line through it so we can clearly see what was there, rewrite what we need to, and initial it. So immediately after an exposure incident, the employee must do these things, right? The very first thing you're going to do is decontaminate the needle stick, right? You're going to push your finger and let some blood come out. You're going to pour lots of soap and water on it, maybe even alcohol and iodine for about 30 seconds. With your eyes or nose or mucous membranes, you of course want to use the eye wash station and flush that out for at least about 15 minutes. Then once you've flushed out the needle stick or flushed out the mucous membranes, that's the first thing you do. You immediately then go to notify your supervisor, okay? When they do the medical evaluation, this is after you have flushed out your wound, after you have notified your supervisor, y'all have filled out an incident report detailing everything that happened and anything that didn't work. Then you go down to the work care or to the emergency room, and the healthcare worker will be tested for HIV, HBV, and HCV. The exposed healthcare worker should receive counseling, medical evaluation, and antiviral treatment and post-exposure testing at 4 weeks, 12 weeks, and 4 months later. This is to keep checking on that healthcare worker to make sure through the process they don't come down with something. They also test the patient. If we're lucky enough to know who the patient was that you had the blood splashed in your eye from, or who was the patient's blood that was in the needle, they can also test that patient to make sure that patient's not positive for HIV, HBV, or HCV. Okay? The exposed healthcare worker should be counseled to be alert for any acute viral symptoms within 12 weeks of exposure. If you start experiencing symptoms of HIV or hepatitis, they want you to alert them immediately and seek medical care. So here's again one of our slides, right? And I want y'all guys to stop this, read through it, and see if you answer it right. So one of your students was disposing of a bloody needle in a sharps container when she stuck her finger on another bloody needle protruding from the sharps container. What should she do first? Okay, the first thing she's going to do is push on her finger to force some of that blood out and anything else that may be in there. Scrub the finger with alcohol, iodine, or soap and water, whatever is closest to her, for at least 30 seconds. Then what does she do? You're going to notify your supervisor immediately, fill out your incident report, and then start the medical evaluation process immediately. So talking about employee health, okay? Most employees are screened for the following diseases prior to employment. You would want to have your titers done to make sure that you have immunity against measles, mumps, right? These are the things that we get our vaccines, right? As a child, we got our measles and mumps vaccines. Well, we used to just say, did you get your measles and mumps vaccines when you were supposed to? You would show your shot records, right? Well, now we've got to the point where we know that that one shot you got when you were a child may not cover you for mumps and measles and other things for the rest of your life, okay? So what we'd rather do now as an adult is draw your blood and run a titer to see if you are truly immune. If you are, then that's fine and you move on. If you aren't, you get a booster shot for any of these diseases like measles and mumps that you don't still have an immunity to. We're going to check to see, we're going to do a screening for TB, right? You're going to be screened for hepatitis. We're going to talk about syphilis and other skin diseases. Now, what they screen you for may depend on where you go to work, okay? But these are some possibilities of things that they may do. So now we're talking about chain of infection, right? And we know that there is, first on chain of infections, there's a source, right? We know there's a source. Things like laboratory coats, scrub suits, and other clothing that comes in contact with infectious agents and is then worn around other patients is a source of infection, okay? So remember how I tell you, I want everybody next week on Tuesday and Thursday, depending on which lab you're in, you must have your white paper lab coat in a Ziploc bag inside your red backpack. Don't forget, because I will check for them on Tuesday and Thursday of next week, because you don't want the possibility of some infectious material being on that coat and then it's just infecting everything that's in your bag and then you're taking that home to your loved ones. So mode of transportation, right? Okay, pathogenic agents may be transported by 5 different modes. There's direct contact, and 97% of the time, infection is spread by direct contact. You directly get the blood in your eye, right? You directly stick yourself with a needle, right? Okay, you put something in your mouth, right? Then there is the air. People are coughing and sneezing, right? Then there's medical instruments. It gets on the scalpel, it gets on the tourniquet, it gets on whatever, and it goes from one patient to the other. There's many different objects, countertops, bottles, anything like that, machines that people touch. And then we have vectors, when we're talking about mosquitoes and things like that that transmit disease. These are all ways they are transmitted from one place or one person to another. Microscopic airborne droplets, that's when you sneeze, right? We've seen those pictures of slow down where people are sneezing, right? And we can see those little droplets all in the air. They become airborne, right? When anybody does that. And also, if you've ever walked outside in the sunlight and shook a blanket, you can see little bitty particles flying around in the dust, right? All this stuff can get in the air, then you can breathe it in, and if there's microscopic organisms on it, you breathe it into your lungs. So we talked about objects, right, that can harbor infectious agents and then transmit infections. These are also referred to as fomites, okay? So a pair of scissors, a pen, a credit card, objects, right, things that can transmit it because I can touch it and then somebody else touches it, right? That's a fomite, okay? And then we talked about the mosquitoes, right? There's also ticks, mites, other things like that, and rodents. All these things act as vectors in transmitting infections. The mosquito will bite one person and then bite you, right? Susceptible host, right? We're still on that chain of infection, the parts of that chain of infection. So, and it's susceptible host is someone that is in a position for different reasons to be more susceptible to getting the infection. When we talked about, and I know you guys heard it on the news when all COVID-19 was going on, that there were people out there that had underlying health conditions, whether they were obesity, heart disease, COPD, emphysema, asthma, that because of those, they were more likely to die from COVID than people that didn't have those things. So factors that affect a host susceptibility are age. We've heard this before, right? The flu affects mainly in the most harshest way the elderly and the young, right? Because little bitty babies haven't built up a good enough immune system yet, right? And older people, because as they age, where our immune system, our body's not as strong as it used to. So one of those factors is age. Drug use, okay? Everybody knows that if you are, we see this with people who have substance abuse problems, whether there's a real severe alcohol problem or a drug problem, they're not getting the sleep that they need. They're not healthy, right? And when they're not healthy for this reason, it lowers their immunity and makes it more likely that they can catch this disease, right? Or get this bacteria or virus or whatever it may be. Okay, the degree and nature of the illness, okay, and the status of their immune system, okay? And a lot of these things, the age, drug use, and some other illness affects their immune status, right? If you're older, or if you're a drug addict, or if you have another underlying disease already, it could affect your immune system. Not to mention patients who are transplant patients on chemotherapy they're doing something to purposely beat down their immune system. It leaves them more susceptible to getting bacterial infections or viruses and things like that, right? So those underlying diseases we talked about, diabetes, HIV and AIDS is going to make you more susceptible to disease, right? And cancer, as well as therapeutic measures. If you're taking radiation therapy, antibiotics, or chemotherapy, remember we talked about earlier, antibiotics go in and they may kill bacteria, but sometimes they kill the good bacteria, and then some other bacteria that's not supposed to be there can take over and then cause you to have a problem, right? This all leaves you open for the possibility of getting an infection, right? You can have a person who has diabetes, they're overweight, okay? They're not very healthy, they're older, okay? Next to a person who is very young, very healthy, great shape, they both get exposed, but a lot of times the person with diabetes and the other underlying issues and problems is the one that comes down sick, or if they both come down sick, the person with the underlying issues usually gets sicker and is more prone to dying from the disease. So breaking the chain, right? That's the whole thing. We want to break the chain. So we all know that the most effective method of breaking the chain of infection is hand washing, right? It used to be that at least 15 seconds was enough for hand washing. Then we went up to 20 seconds, and now really 30 seconds really is where we want to be, okay? On the test, whether you answered 15 or 30, I gave you credit for that on our first test, because as things have changed, especially as we saw the emergence of COVID-19, we started saying, maybe we're not washing our hands long enough. So at this point, really it is best to wash your hands for 30 seconds. So talking about standard precautions, right? So isolation procedures are methods of removing individuals with contagious diseases from society. We've seen this, right? Quarantine. As COVID-19 started unfolding, we would hear about, you've been exposed and you don't know if you're sick or not, so you have to quarantine yourself, or if you know you're sick, you have to quarantine yourself, right? It's the same thing, these isolation procedures. In the hospital, you might go to a room that has a card outside. It may have a big sign on the door letting you know that this particular patient in this room that is in there by themselves, they've been isolated, has TB. And so you have to take extra precautions before you go in the room with this patient to draw their blood, okay? So we have universal precautions and standard precautions, right? So standard precautions state that all body fluids of all patients should be assumed to be infectious for HIV and other bloodborne pathogens. So what standard precautions is telling us, guys, is whether it's a little bitty baby newborn or whether it's your 102-year-old little sweet church-going lady next door, we should treat all body fluids and all patients as if they could have an infectious disease, okay? Now, standard precautions includes universal precautions. And universal precautions state that all patients should be assumed to be infectious for HIV and other bloodborne pathogens. Okay, so universal precautions is where all individuals are treated as potentially infectious, and standard precautions is where all body fluids of all patients are treated as potentially infectious. So universal is all individuals, standard is all body fluids, right? Guys, use these slides as a way to go over and over this stuff until you have locked in your mind that an animal that spreads infection is a vector, like a mosquito or a rat or a tick, and that an object, any object like a scissors, a pen, or anything like that, an object is a fomite. So we're still talking about standard precaution, right? So transmission-based precautions are used in addition to standard precautions for patients with infections that are spread by airborne transmission, droplet transmission, or contact transmission, right? So what this is telling you is based on the way it's transmitted, we may change our precaution, right? So airborne precaution is going to be different than droplet and contact, right? So we have standard precaution, but when we know a person has a specific disease like TB, and we know that it is spread through airborne, then we're going to take extra precautions on top of that to make sure we combat the fact that it is transmitted airborne, right? So we just used, these are used to reduce the spread of airborne droplet transmissions for those diseases such as rubella, varicella, and TB, right? Same thing with droplet, okay? Pertussis, meningitis, pneumonia, or rubella. These are all diseases that they spread through droplets, right? So we're going to take extra precautions dealing with the droplets. And then there's contact precautions. It's used to reduce the transmission of serious infections through direct or indirect contact for disease such as herpes simplex or wound infection. So when you go to a patient that actually has meningitis or pneumonia, there would be extra personal protective equipment, extra precautions you would take when dealing with that specific patient. So we want to take, all right, a few extra precautions, right? So healthcare providers should follow certain guidelines when collecting blood from patients to avoid contacting an infectious microorganism, right? So the use of PPE to prevent percutaneous, which is through the skin, like accidentally sticking yourself, or permucosal, which is through your nose or your eyes, right? With the contact with blood or body fluids. So we want to make sure we wear our gloves, right? We want to make sure we wear our lab coat, right? We want to make sure if we need to, we wear goggles or a face shield, right? Because I told y'all, there is just standard venipuncture with just a patient that no known type of disease, right? They come in to have their blood work drawn. You're going to wear just routine PPE for routine venipuncture. You're going to use all safety devices to prevent needle stick, right? You're going to apply your safety devices. And you're going to wear your gloves, your impermeable lab coat, right? And if you're in a situation like we're in with COVID-19, then you would have to wear a mask too, if that was what was needed at the time, okay? And then there's Peritoneal means any route other than the digestive tract. Okay, so make sure you understand the meaning of that, and make sure you understand percutaneous is through the skin and permucosal is through the mucous membranes, like in your eyes and your mouth and your nose. Okay, gloves should be worn, right? When you're handling objects soiled with any type of blood or body fluids, when you're performing phlebotomy procedures, gloves should be changed after contact with each and every patient, and hands washed or hand sanitizer used after gloves are removed. And we talked about this, right? That chemically cleaned gloves, not sterile gloves, and a lab coat are worn for routine venipuncture. Sterile gloves are saved for surgical procedures, and they're sometimes used when patients have a compromised immune system, or if you're talking about a neonatal unit. So right here, we want to use our critical thinking, right? What is the main source of HIV and HBV exposure for a phlebotomist? Make sure so it would be blood, right? What is the main source of HIV and HBV exposure for a phlebotomist? Blood, right? What percentage of patients get a hospital-acquired infection? 5 to 8%, right? You guys go through the rest of them, right? Make sure you can answer these. Pause this and make sure you can answer each one of these, okay? This is a fantastic way for you guys to study. Okay, so protective equipment, right? Mask and protective eyewear should be worn during procedures causing splashes of blood or body fluids. Now, if we're having a global pandemic, as we've seen, then we might need to wear a mask or something like that. But typically, you do not wear a mask unless you're concerned about splashes or air, or droplets, right? Our personal respirator should be worn for TB patients, because there's a difference between droplet and airborne, right? Droplet could land on your mask, in your lab coat, and it could protect you, right? But that fine stuff that is airborne, that may not. So you might want to wear a personal respirator or a special kind of mask, right? N95s. So footwear, and I talk about this. I talk about it every week when we're in lab. I call them the ugly shoes, right? But the point is you should wear certain type of footwear to protect against broken glass, protect against blood being able to seep through and get to your skin through your shoes. Hands should be washed immediately if contaminated with blood. After gloves are removed, with soap and water every third time the hands are clean. And in other words, if you're going from patient's room to patient's room, and each time you're using the hand sanitizer stuff, and you're not using soap and water because you're quickly going from room to room, and you're taking your gloves off, you're using hand sanitizer, and you're putting your gloves on, you want to make sure every third time that you really go in there and wash your hands with warm soapy water for at least 30 seconds. You want to take precautions to prevent skin injuries from sharps. You want to do it during the blood collection process itself. Remember what I say every week. Respect the needle. Keep an eye on your needle. Be aware of where your needle is. You always want to dispose of your sharps in the sharps container. Remember how I said, don't stick your hand down in there and kind of tap it several times to make sure that it goes down into the sharps container, so the person who comes in behind you doesn't accidentally get stabbed with a needle, right? So to prevent infections from bloodborne pathogens from needle sticks, use safety engineered needles and sharps devices, right? Do not ever recap, bend, or break needles. Do not remove needles from syringes or holders, and immediately place syringes, needles, and lancets into sharps containers after they've been used. So with routine hand washing, friction is applied, and it says 15 seconds here, but we've moved up now. I need to get that changed on the slide. We're up to 30 seconds now, guys. We're up to 30 seconds. We need to wash these hands with soap and water for 30 seconds. Now, for sterile procedures, friction is applied for 2 minutes. And those are procedures dealing with surgeries and maybe neonatal babies and anyone that has a really, really compromised immune system, like someone with a transplant patient or someone on chemotherapy. So isolation for hospital outbreaks. So occasionally outbreaks of a particular infection occur in one or more hospital areas. For example, the nursery, and remember we made that article about babies getting those infections from long fingernails, right? The nursery may have an excessive number of cases of staph infections with Staphylococcus aureus, right? With increased possibility of respiratory infections like multi-resistant TB, avian, flu, SARS, and now COVID-19, right? Patients should cover their mouth and nose when coughing or sneezing and wash their hands, right? Throat cultures are commonly obtained to determine the presence of Streptococcus pyogenes. Okay, that is something we see a lot of times in the neonatal unit. So remember that there can be outbreaks in areas of the hospital like the nursery. Okay, and if you have an area that where you see an increased possibility of respiratory infections, all the ones listed including COVID-19, sometimes we move to wearing a mask more often, or certainly making sure that everyone is washing their hands and covering their coughs and sneezes. So an isolation program that includes specific procedures for dealing with more than 150 different diseases is called disease-specific isolation, okay? Remember we talked about the different kinds of ways they're transmitted, the droplet, the airborne, right, contact, and we dress appropriately with PPE for that. We take extra precautions dealing with those certain kinds of transmissions, right? Well, there's also disease-specific isolation dealing with that as well. So, protective or reverse isolation, right? There's two ways you can call it. You think protective, right? When you think of protective, it's the isolation is designed for patients with the low resistance to disease, such as those with combined immunodeficiency or those recovering from cancer treatment who must live in an environment that is completely sterile. So you've seen people that are on chemo and they have no immunity left. We want to put them in a protected isolation so that everyone that is going in there, we want to limit who's going in there, and we want to make sure that we're keeping that room as completely sterile as humanly possible. So when we're protecting the patient from the outside, that's protective or reverse isolation, okay? So other areas where patients are at a high risk of infection are the nursery, the burn unit, obviously, right? Post-operative care units, the ICU, and the dialysis unit. So newborns are easy targets for infection because their immune systems are not fully developed at birth. And burn patients are usually put in a completely isolated environment for each patient. Each bed is surrounded by a plastic curtain with sleeves. So when we talk about infection control in special hospital units, right, we're talking about like ICU, the nursery, right, or the NICU. So ICU patients are more critically ill, which in turn leaves them more susceptible to infection. Like we talked about that earlier, right? You need a susceptible host, right? So post-operative patients are susceptible to infection because they have surgical wounds or drains. And remember, we talked about the two biggest areas for nosocomial infection is UTI due to catheters and wound infections, due to the fact that they come out of surgery with this wound and we try to keep it as clean as possible, or they will develop an infection inside the hospital because we did not take enough care to keep those wounds clean. Each patient must be isolated and treated according to the type of infection. Okay, in the dialysis unit, this is where patients who have kidney issues go, and since their kidneys aren't working properly, they have machines that their blood runs through these machines and it filters it and then it goes back inside their body. As you can imagine, these people are very ill. So they're often immunosuppressed. Their immune system is suppressed, which makes them more susceptible to infection, especially hepatitis. So in most hospitals, supplies for isolation procedures, like I talked about earlier, are going to be located on a cart just outside that patient's room. There will be signs on that patient's door so that you will know when you see that cart and those signs, stop and figure out what needs to be done dealing with this particular patient. So double bagging, okay? So we're going to talk about procedures dealing with contaminated items, double bagging. It's a procedure where contaminated materials is placed in one bag and the bag is then placed in a second bag held by another worker outside the room. So you imagine you're in the room, you put the soiled material or whatever it may be, even the blood samples, in a bag, seal it up, and then someone else, another worker, will be right outside that room. You immediately drop that into a second bag and seal it up. So the procedural steps that should be followed by the phlebotomist when the patient is in isolation are: your isolation bags for transporting specimens should be turned halfway inside out and left near the door outside the room. So you pull that bag down, right, halfway, and you set it right outside the room. They usually have a cart out there for you. Only the needed supplies should be taken into the room, okay? Phlebotomy requisitions may be left outside the room, right there on the cart. The tourniquet and pins should be left inside the room, or the phlebotomist may use a tourniquet or pin that was previously in that room. They may set you up with stuff in that room from the beginning. You use it in the room, you leave it in the room. Used supplies should be disposed of properly. Remember, think before you toss. Blood on the outside of specimen containers should be removed with a paper towel. The specimen should be placed in the bag, taking care to touch the inside of the bag only. Gloved hands should be washed in the room, turning the faucet off with your paper towel. So here's our critical thinking slides. Make sure you pause these and see if you're starting to understand this. And guys, as you're watching these videos, you should have your black binder out and you should be filling out your review guides for Chapter 4. So that when you're through watching these slides and through reading Chapter 4, you can start studying, because your next chapter will be up soon. So, infection control and safety in the clinical laboratory, okay? The clinical laboratory contributes to infection control by programs in these ways, right? Okay, the first thing is we're going to maintain records for surveillance purposes. In other words, if the microbiology department starts seeing that they're getting a staph infection in room 321, and 322, and 323, they keep up good detailed records on any patients in the hospital that have infections. They also report infectious agents, drug-resistant organisms, and any outbreaks that they see to the infection control department, and they evaluate the effectiveness of sterilization and decontamination procedures. They may bring you something down to the microbiology lab that's a sample from where they swabbed some type of instrument that had been sterilized. You make sure that nothing grows from that to make sure that the sterilization procedure is working. So the lab receives numerous patient samples. Healthcare workers in the lab must be extremely cautious because they often handle infectious agents. The following standard precautions should be adhered to. You must always assume that all specimens to be infectious for HIV and other bloodborne pathogens. You must always use PPE, including a face shield when performing procedure that will generate an aerosol or a splash. You must always appropriately dispose of your waste. You must think before you toss, right? And maintain good personal hygiene, clean clothes, hair, tied back. You don't want to bend over a patient, have your hair come down and touch a wound, okay? And then you want to make sure that your nails are trimmed, that they're clean, and that you're washing your hands frequently. Remember, we went over the safety in a clinical laboratory. Remember, we talked about you don't eat, drink, you certainly don't smoke, and you don't want to apply any type of cosmetics or put your contact lens in or out while you're in there. If you're working in a clinical laboratory, you would avoid storing food or drinks in the lab refrigerator Only keep them in the refrigerator of the break room of the lab that is designated for food only. You would avoid wearing lab coats and other PP outside the lab. I do not want to see anyone walk into my lab wearing their paper lab coat. You wait till you get in our lab, then you retrieve your paper lab coat from the plastic bag that it's in your red backpack, and then you put it on. I have noticed students walking in down the hallway with the paper lab coat on. No, don't do that. And when you're working in the hospital, you will not wear that lab coat all over the hospital. You don't want to be biting your nails or anything, putting a pin in your mouth, okay? Always make sure you try to maintain your health. You know, you want to eat a balanced meal, mainly plants. You want to get at least 8 hours, 7 to 8 hours of sleep a night. And guys, exercise is important, okay? You want to stay hydrated. The healthier you can keep yourself, that means you keep your immunity up. That means it lessens the chance that you can get an infection on the job. Make sure you report all illnesses to your supervisor. Always observe isolation policies. Cover patient specimens at all times during transportation and centrifugation. Make sure you keep your phlebotomy tray organized and cleaned. Remember, the tray itself, you need to take some 10% bleach and wipe the tray down occasionally. And always keep your work area. If you're working in an outpatient station, that chair and that table, all that stuff needs to be cleaned with that 10% bleach. Now remember, we have disinfectants and antiseptics, right? Disinfectants are those harsher chemicals like bleach that are used to clean our work areas, right? They kill pathogenic organisms. Then we have antiseptics. Those are milder chemicals used on skin to inhibit the growth and development of pathogenic organisms. They do not necessarily kill them, right? But they make it where they don't have a real good place to grow. Gloves and gowns should be worn when performing decontamination procedures. It's like I tell you, I don't want to see anybody in the lab spraying their 10% bleach and cleaning their area unless they have their lab coat and their gloves on. The minimum contact time for disinfectants to be effective is 10 minutes. That's why I say the first thing we get out is 2 alcohol prep pads and 2 alcohol prep pads only. Because we want to clean in concentric circles starting from the spot where our needle's going to go in, right? Because we visualized it. We're going to clean out in concentric circles from there, never dragging the bacteria back in. Clean our index finger on our non-dominant hand, that stays in our clean pile. And then while that's drying, because it needs to dry, it needs to be on there for at least 10 minutes to actually do its job, that's when you get all your stuff together, right? We're killing 2 birds with 1 stone. We're worrying about turnaround time and being effective at doing our job, but we're also allowing that antiseptic to do its job. Other things we need to keep in mind, all healthcare workers, but if you have a weeping lesion, that means you have some kind of sore or wound and it's seeping out, right? You've seen this before. You've had probably a cut or something that's weeping a little bit of fluid, liquids coming out of it. You should refrain from all direct patient contact. You do not want to have that on another patient. And pregnant healthcare workers are not any greater of a risk for infection, but they should take extra precaution to make sure they stay strict adhered to all the precautions, right? And then according to OSHA, remember that's our department under the Department of Labor, right? Workers that contract HIV on the job cannot be dismissed from their job. Okay, we have federal laws that require hepatitis B vaccinations be made available free of charge within 10 days of employment, okay? And the first dose is given, then the second dose 1 month later, and the third 6 months later. That's why everyone needs to save up all their money for clinicals, because you're not going to be employed at one of the hospitals that you're going to, but for you to be able to do your clinical rotations at Willis-Knighton and Ochsner's and the VA and Minden Medical, you will have to have your hepatitis B vaccinations started before you can start your clinicals. Okay, and unfortunately, since you're not employed with them, they're not going to pay for this, right? Now, you will have to get this done prior to going to clinicals. So as you see, the first dose is given, then the second dose 1 month later, and the third dose 6 months later. But we will talk about that in our clinical packet meeting on September the 25th. Remember, y'all, block that day out because it will be a Zoom type meeting online, and it is mandatory for clinicals. So under the OSHA HAZCOM standard, or it's also known as the right to know law, right? Employees have the right to know if a chemical that they're exposed to or using on the job is hazardous and what they need to do if they are exposed to it. That's why we have material safety data sheets or safety data sheets for every chemical that we would be using on the job or exposed to on the job. So not only will we know it's hazardous, but we will know that if we accidentally inhale it, splash it in our eyes, or spill it on us, we will know what we're supposed to do. And we will also know what specific personal protective equipment we should be wearing while dealing with these chemicals. So here's another one of those matching, right? Now, how long should you rub your hands together for routine hand washing? Okay, on here, what's your choices? You're going to pick 15 seconds. But like I said, I need to get this updated. Things are moving all the time. Right now, since we saw the global pandemic of COVID-19, we've now went to 20 and 30 seconds, okay? But for right here, guys, go ahead and say 50. We will talk about moving this for your test. And if you pick 15, you will still get credit for that. But just know when you're out there now, you really need to move towards 30 seconds, okay? So pause this slide and make sure you're able to answer each one of these questions. Right to know law, what is it? Remember, the HAZCOM standard. So, chapter 4 on infection control, right? We looked at our objectives, and we remember in this chapter, we talked about nosocomial infections, right? Nosocomial infections are the infections that are obtained while you're in the hospital. In other words, you didn't have that urinary tract infection. You didn't have a wound even when you came in the hospital. You were having surgery, and then that produced a wound, and now you have an infection in that wound, or you have a urinary tract infection that you did not have before you came into the hospital. And as healthcare workers, it is one of the top priorities of our job to make sure that we break that chain of infection and we decrease those nosocomial infections. OSHA is under the Department of Labor and the right to know law, right? You have a right to know if you're working with hazardous chemicals and what to do if you're exposed to them. Sources of infections, right? Modes of transmission and susceptible hosts. You need to know the difference between universal and standard precautions. You need to understand that the isolation and reverse isolation, and you need to understand the process of exposure and an exposure incident. Okay, guys, make sure that you're watching these videos, filling out your review guides in your black binder, and that you're reading chapter 4 in your textbook. The other chapters will be up shortly. You guys have a great day. See you next week.